Hello fam, I hope you're fantastic as I am. My good names, yes, my good name is Gladwell Migwi. Ama ukipenda, you can refer to me as G. Yes, so today here we're going to discuss a feminine topic, yes, that a percentage of us ladies go through and they don't know what is happening to them, and yet they don't know what it is called, they don't know what the issue is. But today I'm here to educate you guys. Mwachange kusema oh madaktari use very difficult words we don't understand. Oh madaktari, you just write things that you don't understand. But here I am, guys, to educate you, to make okay, this is a topic that will be made more open. Also feel ashamed to express yourself when you are consulting a doctor. Also feel ashamed. So right about now, let's begin. So kindly, before I begin, kindly subscribe to my channel, comment, leave a like, share. Yeah, road to 50 subscribers. Kindly guys, allow me to reach there. Nifikisheni hapo tafadhali. So today we are going to talk about menstrual disorders. These are the disorders that occur when you're menstruating, when you're having your menses. Right about now, without further ado, let's begin. Kuna ya kwanza inaitangwa menorrhea or hypomenorrhea. Sorry. So this is heavy flow that is more than 80 milliliters when measured. As in, ukiamua kuimeasure ina amount to more than 80 milliliters. This can be excessive, and also pia kwa masiku, like duration, it can occur even more than 7 days. Una bleed too for more than 7 days, alafu it's large in amount. Some of the causes of menorrhagia ama hypomenorrhea can be intrauterine copper device. Kwa wenye wanatumia family planning ya IUD, some of them may experience that. Adenomyosis. What else? I had forgotten. Okay, nimeandika mahali. Endometrial hyperplasia na pia uterine fibroids. Fibroids ni zile growths zinazokaa inside the uterus. Yeah. This cyclic bleeding, nimewambia inaweza kuwa excessive in amount, na pia kwa masiku, like duration inaweza kuwa more than 7 days. Okay. Nimewambia hizo causes hizo za hapo juu. Na pia kunaweza kuwa na systemic causes. So, by meaning systemic causes ni za mwili sasa. Kuna wenye wanaweza kuwa na severe hypertension, kuna wenye wanaweza kuwa na leukemia, kuna wenye wanaweza kuwa na platelet deficiency, kuna wenye wanaweza kuwa na liver dysfunction, kuna wenye wanaweza kuwa na hypothyroidism, hyperthyroidism. Kama sijajirudia, kuna wenye wanaweza kuwa na congestive heart failure. These diseases pia zinaweza bring about menorrhagia. Si zile tu zenye nimekuambia kuhusu endometrial hyperplasia ama fibroids, also this can bring them. And so what I can tell you to manage, to manage this condition, kindly seek medical attention. Go to a doctor and consult. Usifeel aibu. Don't feel ashamed to ask anything. No, don't. When you go to a doctor, you're going to treat the underlying cause. Mtaweza hadi ku-account the increased change of pads. Mtaweza ku-account sasa mjue I have this condition, by the way. And then most of all, you have to accept I have this condition so that you may be able to heal. That is a process of healing pia. So we have talked about menorrhagia ama hypomenorrhea. The second one is called polymenorrhea. Ama wengine wanasema polymenorrhea. Polymenorrhea, this is bleeding that occurs limit less than 21 days. Unapata like your cycle, nimewambia the normal cycles kuna za 21 to 28 days, 21 days, 28 to 35 days, 28 days. Okay. So hii polymenorrhea inaoka less than 21 days. Unapata today you have your menses. After 10 days you already have your menses. Now that is what is called polymenorrhea. Kindly visit a doctor if you have this condition. Yes, if you feel like, kindly go. It can be caused by ovarian endometriosis. Unaweza letwa juu ya I had written somewhere. Let me check. Hii content ni mingi na ni muhimu. Pia inaweza kosiwa na ovarian hyperemia. In the case of pelvic inflammatory disease, Let me give an example. Unaweza kuwa na STI, alafu sasa ikuwe kama STI ni sexually transmitted infection, then sasa iform hii sasa itakuwa a form of pelvic inflammatory disease, then it cause ovarian hyperemia, inaweza fanya ukuwe na polymenorrhea, which is an ovulation ama a shortened luteal phase. Naona ile time yenye una ovulate hii itangwa luteal phase hapo. Alafu sasa hiyo ni sasa nimekwambia ya pili inaitwa polymenorrhea. The third one is called menorrhagia. Menorrhagia is irregular, a cyclic bleeding from the uterus. This is bleeding that occurs between any time in the menstrual period. As in, you have your menses, yes, but you're also bleeding. This is called menorrhagia. Some of the causes can be menopause. You can have the carcinoma of the cervix ama cervical cancer, or submucous fibroids, or ukuwe na infection kama chlamydia. Chlamydia is a type of sexually transmitted infection. And also unaweza kuwa na tubercular cervicitis. Yes, cervicitis means inflammation of the cervix. Tubercular cervicitis. This is what can cause menorrhagia. Nimekwambia ni irregular cyclic bleeding that occurs between your menstrual period. That is the third one, guys. That is the third one. If you're having any of this condition, kindly seek medical attention. Don't be ashamed. Usiogope. And I'm here to educate you. Kukuerevusha, open mind. Usikae tu hapo ukijiblame, okay, I'm having this condition Z. No. Lazima mjue nini inasumbua some of us girls. Haya, the fourth one is called menorrhagia. You see, the other one was menorrhagia. The other one was menorrhagia. This one is menorrhagia. This is bleeding that is so irregular and excessive that now you won't be able to identify if you're menstruating at all. You will not be able to know hata hautajua. This is bleeding that is so excessive and irregular. Alafu inafanya hata usijue kama una menstruate because it's too much. The fifth one is called oligomenorrhea. So this is menstrual bleeding that is occurring more than 35 days. As I told you guys again, niliwaambia kuna yenye iko 25 to 35 days. Sasa hiyo oligomenorrhea ni more than 35 days. More than 35 days. Na huko inapita hadi inakuwa 40 days, 45 na huko. Sasa hiyo ndio unanyesha like a month ama a month and a half later. Ndio sasa unanyesha tena. You see? That is what is called oligomenorrhea. So alafu ina happen hivyo, inakuwa di constant. Sasa inakuja after every 1.5 months, every 2 months hivyo. That is what is called oligomenorrhea. Some of these causes can be menopause. Menopause. Unavyo tunaiongelelea hapa. Menopause is a big issue. Yes, menopause. Obesity. These weight related causes. Sasa obesity. Kindly guys check on your weight. Do exercise tafadhali. Kuna stress and exercise related. Sasa juu nimekuambia ufanye exercise, don't overstrain yourself, no. Just do normal exercise that will help you cut off that excess weight that you have, that excess fat that you have. And also as for stress, mental health is a very big issue that has been talked over and over. Kindly know how to manage your stress tafadhali. Everyone has stress, by the way. Kila mtu akona kitu inamsumbua, but as for you, know how to manage your stress. That is all I can say. And also some endocrine disorders. When you say endocrine disorders, unaweza kuwa vitu kama hyperthyroidism, vitu kama hizo. Then pia kuna drugs kwa wenye that have pressure ama hypertension. There's a drug called methyl-dopa and they use it. This drug can also cause oligomenorrhea. Usianze kujiuliza sasa hii mashida niko nayo ni gani. Also check if you're having hypertension and you're taking methyl-dopa, maybe that can be the cause of or that is what is bringing oligomenorrhea to you. Okay, the sixth one is called hypomenorrhea. Hypomenorrhea, this is when your menstrual bleeding is so scanty and also it lasts for less than 2 days. I told you guys, the days of flow need 3 to 7 days. Those are the normal days. If you have your periods for only 1 day and it's too scanty, as in ni kidogo, that is hypomenorrhea, guys. Don't be happy when you're only having your periods for 1 day and that's it. And then it's as in pia inakuletea questions, it's only one day, alafu pia ni kidogo. Hey, kindly jaribu ku gather more, jaribu kujua more. Can I be having hypomenorrhea? Yeah. Alafu I did not talk about the one that is common to everyone. This is called dysmenorrhea. This is pain when you're menstruating. Lakini kuna wengine that is too severe that we should be questioning about endometriosis. Ni sawa. Kuna dysmenorrhea, kuna ile the normal one, the ones who have mild cramps, moderate cramps, enye you can handle. But then kuna za hawa lazima wadungwe sindano, they go to hospital, get medication so they can be able to handle the cramps. You should also be questioning about endometriosis then. But now we have talked about the 7 menstrual disorders, and now I think you guys are now happy that you know. Some of us experience all this, but they don't know. But now I'm sure you will know. Pia sasa utaweza ku raise questions, sasa utaweza kwenda hospitali ujue, by the way, this and this is happening to me. Yeah, that is about it, guys. Thank you for sticking here with me and listening to me. Thank you so much. Kindly subscribe to my channel. Kindly watch my content to the end. Kindly like my content. Leave a like. Yes, leave a like. Comment, pia. You can also share this. Thank you so much. Yeah. Bye bye. Thank you for watching.